Deputy Seán Kyne, question number 10.
Minister, the question regards to the plans for replacement of health centre in Inishbofin Island and in relation to the plans in relation to Corrandulla Health Centre.
Yes, miss.
The development of primary care is central to the government's objective to deliver a high-quality, integrated and cost-effective health system. Primary care infrastructure is being delivered through three mechanisms: direct build, leasing initiative and public-private partnership initiative announced in the July 2012 infrastructure stimulus package. The development of primary care centres through a combination of public and private investment will facilitate the delivery of multidisciplinary primary care and represents a tangible refocusing of the health service to deliver care in the most appropriate and lowest cost setting. Considerable progress has already been made in the delivery of primary care centres. Since this government came into office in March 2011, 37 primary care centres have been opened, and infrastructure development is underway or at an advanced planning stage at a further 43 locations, where delivery is expected over the period 2014 to 2016 and early 2017. As with all capital projects, the primary care infrastructure programme must be considered within the overall capital envelope available to the health service. There will always be more projects than can be funded by the Exchequer. There is limited funding available for new projects over the period 2014-2018, given the level of commitments and the cost to completion already in place. The HSE is concentrating on applying the limited funding available for capital works in the most effective way possible to meet needs now and in the future.
Deputy Kyne.
Thank the Minister for his reply, and I do commend the Government in relation to the work that has been ongoing and the number of primary care centres that have opened in Athenry and Loughrea in the last period of time in Galway. Regarding the two projects that I mentioned, there's no update on those projects. I spoke to you before regarding Inishbofin, and there was back and forth between your own department and the Department of Art, Heritage and the Gaeltacht regarding who had eligibility, or who had responsibility, I should say, for this project, because there was an issue previously that the Department of the Gaeltacht and Islands had responsibility for an island community. But I understand that that has been cleared up, perhaps you might be able to come back to me with the progress on that health centre, and also Corrandulla, which is presently closed but I understand is listed for refurbishment. An issue that arose quite often during the recent canvass, and locals in that area who have to go to Turlockmore to attend a primary care centre or health centre, and there was concerns that this the Corrandulla centre may not reopen.
The Deputy is correct, and he has raised this issue before. And can I indicate to him, and through you, Ceann Comhairle, that I will revert to him within the next day or so in relation to the issue that I'll do so quickly. Because I know the issue that he's raising, and I give him that undertaking that I will do so today or tomorrow at the latest. I will revert to him. And the issue of primary care centres, I think generally I welcome the Deputy's support. And I just in recent weeks, and I know Deputy Riley also in recent weeks, has had the honour of opening additional primary care centres in different parts of the country. And when you go to these primary care centres and see the value that the community places in them and the incredible services, I've opened one in Scull in County Cork recently, one in Blanchardstown, one in Summerhill, County Meath, and the Minister, I think, was opened. One a month, in fact, has been open since the government came to office. And we get a great deal of criticism, and some of it justified, a lot of it's not so justified. But can I just say to the House that I would ask the House, draw the attention of the House and colleagues to the amazing, incredible work that's been done in the primary care sector, in particular the provision of new build, housing of services under one roof, obviating the need for people, for example, as I saw in Scull, County Cork, to have to travel long distances for services that should be available and now are available in their own community.
Thank you.
And this is the kind of change that's taking place in our health services, extremely valuable to communities all over the country.